Hello everyone, my name is Megan and I'm so glad that you clicked on this link today. Together, we're going to look at the history, composition, and mission of the Northwoods Coalition. Formed through a partnership between Marshfield Clinic Health System and several community coalitions in 1995, Northwoods Coalition is the largest and oldest network of coalitions dedicated to substance abuse prevention in Wisconsin. Marshfield Clinic Health System is an integrated health system serving Wisconsin with more than 10,000 employees, including more than 1,200 providers in 86 different specialties, a health plan, and research and education programs. The mission of the clinic is to enrich lives, and this is done through accessible, affordable, and compassionate healthcare. A question that we typically encounter is, why does Marshfield Clinic support community outreach? The answer to that question is embedded in the expanding definition of healthcare. As part of good practice and as part of the concepts driving healthcare reform, we are recognizing that health improvement is an important responsibility within communities, not just within clinics. Doctors cannot do it alone. Health improvement does not occur just within the walls of a doctor's office. The majority of our patients spend relatively little time each year with their physician, but they do spend the majority of their time elsewhere in the community. When individuals are with their doctors often recommend all types of things to do to get healthy or stay healthy. Stop smoking, stay out of secondhand smoke, don't drink so much, don't let your kids drink before they're 21, exercise, etc. So most of our patients think we give pretty good advice. They go home with the best of intentions, determined to do the right thing. But now it's out of the doctor's hands, and the rest is in the hands of the community. We know that if hometowns have the right dosage of programs, practices, policies, and systems, our patients are more likely to make the right health choices. For example, if a community conducts compliance checks, it becomes very difficult for our youth to purchase alcohol or tobacco products. When a community comes together at a town hall meeting, everyone becomes more tuned into the critical issues we face with underage drinking. When moms and dads form a parent network, there are fewer opportunities for kids to drink in homes. When coalitions focus on healthy eating and active living, fresh fruits and vegetables find their way into schools and homes, and there are more community venues for safe and affordable exercise. When communities form coalitions with representatives from all sectors of society and take action to create healthier environments, things really start to happen. When our clinics engage with their communities, we ultimately make it easier for our patients, for all of us, to follow the healthy lifestyle recommendations made by our physicians. This is why Northwoods Coalition has found its perfect home within Marshfield Clinic Health System's Center for Community Health Advancement. With Marshfield Clinic Health System's mission to enrich lives and an entire center dedicated to improving the health of our communities, we set out to determine a set of health priorities to streamline our focus. In 2018, as a result of conducting a qualitative and quantitative assessment of our community needs, which included hundreds of key informant interviews with partners at the local, regional, and state levels, Marshfield Clinic Health System identified 4 interconnected key community health priorities known as our ABCs. These priorities drive our work as a health system, center, and organization of coalition. Again, we were formed in 1995 through a partnership with Marshfield Clinic Health System and several community coalitions. Representatives from coalitions in a 35-county region, including all 11 of Wisconsin tribal nations, serve on a non-governing advisory board to help shape policies, practices, and programs which address public health issues arising from the use of alcohol and other drugs. Marshfield Clinic Health System Center for Community Health Advancement staff provides support including education, training, technical assistance, and other resources to members of Northwoods Coalition. Since 2007, through a contract with the Wisconsin Department of Health Services, Marshfield Clinic Health System Center for Community Health Advancement has served as the Northern and Western Regional Prevention Centers for the Alliance for Wisconsin Youth, the AWY. The purpose of the Alliance for Wisconsin Youth is to enhance and support the capacity of coalitions in substance abuse prevention and youth development. Over 100 Wisconsin coalitions are members of the Alliance for Wisconsin Youth, including those belonging to Northwoods Coalition. Hence the tri-logo that you will see on any Northwoods Coalition branded handout. Because Northwoods Coalition serves and is comprised of coalitions from such a large region, we decided it was best to separate out into 4 different subregions. We did this for a few reasons. Each geographic region may have differing focuses. For example, methamphetamine versus tobacco versus positive youth development. Separating out also allowed our Northwoods Coalition staff to focus more closely on one specific region and its coalitions, offering better technical assistance and availability. Coalition representatives from each region meet 4 times a year as a region to network, share successes and strategies, receive training, and hear about efforts at the state and national levels. Coalition representatives from all of our regions get a chance to meet together every other year at our Northwoods Coalition Prevention Conference. Our vision is strong coalitions, healthy communities, and we plan to achieve this by supporting diverse community coalitions working together to promote effective substance misuse prevention through networking, advocacy, mentoring, and leadership. We work towards our vision and mission through the following: our biennial Northwoods Coalition Prevention Conference, quarterly regional meetings, which is a chance to meet with all the Northwoods coalitions in your region, year-round training opportunities, our bi-weekly News You Can Use newsletter, coalition success celebrations, scholarship and funding opportunities, professional development opportunities such as the AODA Prevention Specialist Certification, resource sharing, local coalition building and training on the Strategic Prevention Framework for continued success, policy change initiatives, and prescription drug collection and disposal. The Northwoods Coalition team is comprised of our loyal, strong, and hardworking coalitions, our Northwoods Coalition Advisory Board. The individuals on our Northwoods Coalition Advisory Board are selected by you and are here to voice the needs in your community. They're considered the representative for your region and are here to help. The third member of our Northwoods Coalition team is our Northwoods Coalition staff. Again, we have staff members dedicated to representing each Northwoods Coalition region, providing training and technical assistance, managing funding and scholarships, and acting as the experts in many different coalition capacity building exercises and drug trends. If becoming a part of our Northwoods Coalition team seems at all interesting to you, the first step in getting connected is to email our AODA prevention team. From there, you'll be able to view our welcome packet, get on your region's email list, subscribe to our News You Can Use newsletter, browse through all of our Northwoods Coalition Google Drive, and even attend an upcoming regional meeting. Our team will be eagerly awaiting your email, and we can't wait to have you join us in reaching our vision of strong coalitions and healthy communities.